Hello,
Hello, everybody.
where's the conference room?
Hello.
Okay, Darren, you're still muted. The conference room is muted.
Yeah, the conference room
Okay.
is muted. Hi, Larry, it's Samantha. We'll come off mute in just a moment when we're ready to start, because the streaming.
No problem.
He's sick today.
Oh,
Yeah.
hopefully he's not got COVID.
No, I don't think so.
Again.
Maybe we'll just wait a few more minutes. We're trying to count and see if we have a quorum. So
How many do we need?
I think we need one more.
We have this again. We hear from anyone coming?
One person we've heard from, and I believe we can't count online.
Yeah, you can't count online, but I'm here. What? Why have we muted again? Hello?
Yeah.
Okay. Yeah, nobody
Truth
who's,
Larry?
yeah.
Everybody can't vote. You know, on other boards,
Well, some of ours
I'm aware of,
would
you
be a
can vote. When you're,
potential member if she would. You're not at quorum?
She's
Yeah,
here.
yeah, the school system board,
I just thought you said that, Larry.
It's Samantha. We're just gonna stay on mute until you're ready to start, because the streaming has actually already started. So if we could just keep the conference room on mute until you're ready to go, that would be great.
Laura's on.
Oh, thank you.
Hi, Tom.
Hi, I finally got on.
Yeah, I guess because they haven't called to order, they're keeping us on mute.
Yeah, okay. I had my computer fixed. Now I can't figure out how to work it, so. So much for the fix.
Have they started yet? I mean, obviously, whatever conversation they're having, it would be good for board members, even if we're not present in the room, to hear.
The microphone may not be turned on.
Well,
I think the problem is that they don't want to broadcast it to the world. So I get your point. Because we are streaming on YouTube now, I think.
yeah, I understand that. But I mean, this is the problem with having this idea that somehow because we can meet in person, that somehow participating remotely is a lesser version of that, even though that during the pandemic, we did it all the time.
Larry, I think we're ready to start. Thanks so much. Okay.
So we're unmuted here, ready to go?
Good, and I'm just going to start the Zoom recording and then you can begin. Thank you so much, everybody.
Okay, so we'll start our meeting. This is the meeting where we transition to new leadership. So that'll be on the first item of the agenda after a little bit of business here. And we're glad to have Tiffany Bloss from Suicide Prevention visiting today, and she'll be filling us in a little bit about what's been happening over there. So we're looking forward to that. So just for basic information, why don't we do introductions so Tiffany knows who everybody is and what our connections are. I'm Mary Hutchins.
I'm Elise Schweitzer.
Sally McConnell, Janae.
Jessica Connor.
Corinne Palazzo. Harmony Ayers Friedlander.
Sheila McHenry.
I'm Stu Bergman.
I'm Jan Lynch.
Okay, and those of you on Zoom, do you want to introduce yourselves?
Tom Lipa.
Larry Roberts.
I believe Sue Lamar is here too.
Hi, Sulimar.
Great. Thank you. All right, so we need to approve the minutes from November and December. I have a motion for that.
I have a correction.
Maybe there'll be a point where we can ask for that. Thanks.
From one by one.
We could vote on them one by one, but that would be fine too. How about November? A motion to approve the November?
I'll make a motion to approve the November meeting minutes.
Okay, and Sheila.
I can second.
So any discussion about November's minutes?
I just wanted to correct, I was marked as excused, but I was indeed there. And also I have a PsyD, not a PhD.
You have a what?
PsyD. It's just a different kind of doctorate.
Okay. All right.
Yeah, also I was at the meeting.
Okay,
Oh, okay.
any other corrections for November? All in favor of accepting the November minutes with that correction? All right, they're approved. The December minutes, can I have a motion to accept them?
So moved.
Sally, a second? Jessica, any corrections to December or discussion about December's minutes?
This is Larry. I was listed as present, but I wasn't present.
Oh, okay,
I wasn't even on Zoom, so I didn't.
okay,
All right.
thanks, Larry.
Sure.
Any other corrections or discussion? Jessica's credential corrected there too.
Okay.
Okay, and all in favor of approving December with those corrections? All Right. All approved, thanks. Any privilege of the floor? Larry?
Since, did I hear that Frank isn't there?
That's right.
Okay, so I'll wait for a topic I wanted to bring up, which was just an update on where we are with housing. And also, I don't know, and the other thing I'd like maybe some discussion about when it's time for a report is the Ithaca Voice reported that the Community Justice Center is moving ahead with a project to pair county department staff with police officers responding. The two things about that, I'd like an update about that. And the other thing is, I'm wondering where the idea of an unarmed response has disappeared to. Because if you remember, when we began to talk about the kinds of options we might develop here, we had a great deal of interest in the cahoots model and sending social workers with armed officers is not the cahoots model. So I'd like to raise that, and I don't think that discussion is over, and I wonder where it is.
Okay, so we can pass those questions on to Frank for the next meeting. Would that be a good
Well,
next step?
Yeah, I guess I'd be happy to wait until the next meeting. I'm just concerned that we have a real update about what's happening with the alternative models of response, because I don't see an unarmed response being a serious, under serious discussion. In fact, the article in The Voice went out of its way to make sure we understood that it wasn't an unarmed response. And has that gone off the table? And if so, why and where is it?
Okay. Well, I'll make sure we pass that on for next month. All right.
Unless Harmony has something she can address this evening.
I think, Larry, it would maybe be helpful to have Mona Smiley come and talk with people from the Community Justice Center and the people that are directly working on that issue.
Okay.
That may be something we want to do have an invitation to, but to get an update from her directly.
All right, great.
Okay. All right.
There's a raised hand.
Yes, Veronica?
Yeah, sorry if this is not the moment, but on that topic, a quick question maybe for Harmony is, with the new co-response thing, is the mobile crisis team as we know it now going to stop existing, or will it continue existing?
So the mobile crisis team will be changing because the sheriff's department is ready. They have a special vehicle that is less, it doesn't like scream law enforcement, right? And they have a different uniform that the co-response deputy will be wearing, and they've pretty much moved forward with that work. But the other part of that team is somebody from the Ithaca Police Department, and they're not quite at the same pace. So what we'll probably end up doing is having our current model in the city and start this new program, co-response program, in the rest of the county to begin with. But once that full model is implemented, the current formula of the mobile crisis team will be changed. And then, we'll also maintain our partnerships with the Rural Outreach Program through Family and Children's Service, which is has a van and a team of 2 people who do respond without law enforcement for less significant situations or when no one's called 911. So the co-response team will respond through dispatch when it's a serious situation from 911, or if somebody chooses to call 911 instead of 988.
So I'm correct then that an unarmed co-response for people in mental health crisis is not on the table in the way that it has unfolded in other parts of the country.
I wouldn't say that, Larry, because there are a number of other types of models that are being reviewed by that group as well. So I wouldn't say, like, we have the LEAD program, we do have the outreach worker program. Both of those are well, the LEAD is through law enforcement, but the outreach worker program is not. And I don't know where the status is on that work because it's not under us, but I wouldn't say that that means it's off the table. It just may not have matured to the same point as this other work.
Okay, all right. Well, I look forward to a more substantial update in February.
Okay, thanks. So we need to move on to our vote on the slate of nominations for the chair and vice chair positions. We shared that slate in December, and at this point, we need to see if there's anyone else who is interested in being nominated for any of these positions. So this is an opportunity if you have been yearning for this.
Strike that from the record.
So at this point, if someone would like to nominate the current slate that we have, that would be great.
Nominating, yeah, I put into your consideration for the chair to be Alicia.
Elise.
Elise Schweitzer, I get that part right?
Yep.
Who is presently our vice chair, who traditionally gets the heads up a year ahead of time. Being the vice chair, you become the chair, most likely. And that vice chair opening, we'd like to nominate Jan Lynn.
Yes, you do. You got it right.
So that's the slate.
Okay. Can I have a second for that? Okay. And all in favor?
Go for ourselves. I think.
Yes. All right. Okay. I will hand things over.
Well, thank you, Mary, and thank you again for stepping in for 6 months when Maria had to step away as chair. Really appreciate it because I wasn't ready to be chair yet at that time. Thank you so much.
Yeah, that was great, Mary. Thank you.
Yes, Mary, thank you for all you've done.
Oh, thank you. My pleasure.
Really appreciate it. Okay, so we'll move on to the next agenda item, which is an update from Suicide Prevention and Crisis Service from Tiffany Bloss, Executive Director. Welcome.
Thank you guys very much for the opportunity. I stepped into this role in April. Little background on me, I've been in nonprofit leadership for about 20 years. Mental health has always been near and dear to my heart. I've got a 19-year-old that has struggled a lot, spent a long time hospitalized, upwards of 2.5 years altogether, hospitalized for different mental health issues, and did a 611 program to complete high school, which he graduated last year, which is super awesome. And he's doing really well, but when he started his mental health journey, his first attempt at suicide was at 10 years old. And I, as a mom, just wanted to educate the entire world on how you can help to know the signs, talk to someone, not be afraid to say the words, "Are you thinking about suicide?" So I independently went and got trained to facilitate safe talk as a mom, and I would rent out a room in my local library once a month and do a training for free for everyone for years because I just wanted the whole community to be safer. This position came open. I was at Schuyler Hospital working as the foundation director over there, perusing Indeed as people do oftenly, just taking a look at what was out there. And it very quickly spoke to exactly what I was looking for. what I could help invest in the community. I'm not from this community. Please don't shun me for that. I live in Chemung County, so I commute every day, but it is a million times worth it because we touch Chemung County as well. And it's a great opportunity to be able to spread the word and help to break this stigma much farther than what it is. And we're making good progress, even in the little bit of time that I've been here. Anybody that is familiar with the recent history with suicide prevention, there's been some struggles and some opportunities for growth there. And we've really been hitting the ground running the last 8 months. We have answered in 2022, 6,186 calls, which is really great. It's about an average of 360 per month. 988 specifically is 1,865 of those calls, which means 4,300 of them are on our local line, which we get calls all around the country on our local line. People Google our website. We ask them often, like, where did you learn about our number? They may be here for school or work and then move someplace. They keep our line, which is really great and something that we're very, very proud of. Our answer rate right now is 91%. State average is 83%. So we're doing really good with that. Our average talk time is about 16 minutes with each person that's on there. So we're proud of how all of that is going. Since 988 officially, like the number for it, rolled out in July, it is the same exact service that people could get before, an easier way to access it. We have seen an increase in the volume of calls for that number. It's a lot easier for people to say, call 988 versus call 800-273-TALK. So we're happy with that. They overall nationwide are planning a huge marketing campaign coming up this spring and summer. They wanted to make sure all of the 200 call centers around the country were ready for that first with staffing and all of that. That is one place that we have struggled a lot with the staffing, but I have good updates that will be coming very soon. Community education, we have done a lot in the community. Like I said, I teach Safe Talk and have done for a lot of years. We've got a couple of those that will be happening once a month in-house. We're also doing Assist, a minimum of once a month in-house. That is a core piece of our training for our crisis line counselors. And we want to be able to open that up to the community to attend as well. Any kind of education that we're providing is at no cost to anyone. It can be 30 minutes via Zoom on a Talk Save Lives presentation of what general suicide awareness is, or it can be the 2-day assist in our office, and we will teach it to anyone for anything, which is great. We have an assist actually coming up this Friday and Saturday, which is good. And I was trained to facilitate that as well in, did I do that? October. I think I went to Syracuse for a week for that. So Sally Manning is also trained and she's doing a lot of these co-workshops with me, which will be really great. We are working with Cornell EARS, making sure that all of their students have the active listening training and all of that. We are tabling anywhere and everywhere that we can so that people are getting more of the word about what we can do. A lot of online stuff that we can do. We did a lot of training with the American Foundation for Suicide, so that it's real, the Teen Saves Lives, mental health, all of that kind of stuff we're doing as well. One of the really great things that we were approached with I'm assuming people seeing how good we were doing. I don't know if anybody has ever heard of the company called Early Alert. It's fairly new. It's a nationwide organization that is all about proactive suicide prevention. And I have a couple of their FAQs here that I can pass around. I probably don't have enough for everybody, but I've got a couple of them. But what they do is have a bunch of organizations that subscribe to a texting feature with them. And once a week, they will send them a wellness check. How are you doing? They will have 12 different categories and rate yourself emotionally from 0 to 10 this week. How are you doing? And then the subscriber can then put in a comment. Those comments are then sent to a suicide prevention organization to triage, whether that's no risk at all, whether it's a medium risk that maybe we should check it out, or it's a high risk and we really need to check it out. We currently are the suicide prevention organization that is paired with them, which is really exciting. We started with them December 1st. They are a fairly new organization, but they have 74 organizations nationwide that they are working with. Majority of them are like intermediate school districts, middle school, high school kids, a lot of colleges that they're working with, universities, and then they're breaking into like medical hospitals, some lawyer organizations, and also the veteran population that can anytime text this early alert. We get an email, triage them. If we deem it either moderate or high risk, we get that subscriber's information to do an outbound call or text to them. So since we started with that in December 1st, we have done 201 triage requests with them, which has been really great. The company provides all of the resources based on the different things. So if we've got a college kid that's like, my, financial status isn't sound, we have their financial advisor's name and phone number that we can then provide to them as a resource, which is really great. And also practice some of that crisis counseling. So we're happy with that organization, and we feel like that's going to continue to grow for us, which is exciting. Staffing wise, as we have been growing and developing, we in the last couple of months have been able to promote 3 people internally. We've promoted one of our counselors to a crisis line manager and 2 of our counselors up to trainers. So they are helping us to bring on new folks. We have a new director of operations that starts tomorrow. I am so excited for. We are currently actively hiring for a couple other vacancies that we have. We've got 6 places on the crisis line that are vacant. And we also are looking for a part-time community relations person that can take on a lot more of this tabling stuff, and a licensed social worker. And we've got, I think, 4 interviews this week for that position, which is great. Our crisis line itself, we have 3 full-time workers, 14 part-time workers, and 4 volunteers trained right now. We've got a class of 7 that starts on Thursday to add to that mix. We will continuously be bringing on new folks. Our goal is between 40 and 50 volunteers, so that each one is working 4 hours a week as a complement to all of our staff that are already on the lines. So that'll be really great. Our board of directors has changed over as well. We've got most new leadership on there, and we have doubled it in size. And our goal is to be at full capacity by the end of March for our board. We've still got 3 open positions. So we're trying to recruit very intentionally for those, for the needs of the organization and what we're looking for. 2023, we have big plans. So many big plans. So our operational hours right now are 10 a.m. to 10 p.m. Monday through Friday. We had to shift when we transitioned to 988 because of our staffing issues and some leadership changes and other things that happened. We are scheduled to go 24/7 again, February 1st of this year, which is really exciting for us. We are also looking to introduce a 24/7 warm line for the community. That also in February for some of our lonely and isolated callers that aren't necessarily in crisis. And we have some that identify, I'm not suicidal, I'm not in crisis, I just want to talk. They belong to a warm line, but there aren't any right now after 3 o'clock. So we have the capability to do that. So we want to bring that to the community. Board of directors, like I talked in March, we want to have that fully staffed. We also are working out a program for outbound telecare check-ins for folks. And that can be warm, nice 5 to 7 minute calls to the elderly population. Could be recently discharged from the hospital, not just the behavioral unit, but maybe somebody just got a new diagnosis. They've just, started a different medication. We can do that outbound call to them to kind of check in, like, how are you doing? I know a lot of the providers will do it for like a week or 2, but then what happens after that? If like that's the way that person needs to function, is to continuously have that reminder. We'll have the capability to do that. And this can be check-in once a day or check-in twice a day, but really the focus is to keep people social and to keep the high-risk community out of the hospitals and out of placement. We are really excited with the Community Recovery Fund to be doing a full call center renovation. That will happen this spring. We are expanding from 4 call center stations right now to 12, which is really great so that we can offset the operations of having 24/7 and adding all of these new lines. We just got new call center software, so everything is routed better, and that's how we're able to increase our answer rates and all of that and support people in a better way. There are a couple more like low-key exciting things. I talked with 988 this morning actually about the progress that we've been making and the good strides that we've had the last couple of months. And we, previous to 988 officially rolling out, we covered 11 counties through that service. We are slated to get all 11 of those counties back very soon. They're in conversations with OMH, but they've seen the progress and they've seen our staffing changes and all of that, and we're ready to be able to handle all of that, which is really great. The other thing that they are looking at us for, there is a need nationwide for an adult LGBTQ crisis line. So they are looking at implementing one of those later on this year, and having us be one of those pilot centers. We've got a really, really diverse staff, which is great. That is also one that's near and dear to me. I've got a transgender son, and I've been a Trevor Project Crisis Chat Line counselor for a number of years because of that, because that is a very special population. But we've got multiple staff that are part of that community, and they Vibrant, who is the administrative lead over the 988 services, has been to our center and has met a lot of the people and the community and all of that. They think that we would be a really good fit to be a pilot program for that nationwide, which is really exciting too. So we have a lot of big, good, exciting things happen. It's been a lot to juggle, and it seems like it's happening very fast. In my brain, it's like, why isn't this happening yet? But we're just continuing to grow and thrive and really look at what the needs are in the community and see where we can fit those. So we're excited about all the progress that's happening.
Seems like you're doing a ton. I'm going to ask you a quick question and I'll throw it open to everyone else for questions. What has been your engagement with the school districts locally?
With our school districts here, it's been very minimal right now. A lot of them, when we've communicated with them, they're really looking for like chat services. For a lot of the kids, they're not going to pick up a phone and call. So we are working with our web designer right now to, by the end of the month, implement our chat services back on our website. So, and then once we're 24/7, that'll be a 24/7 service that the kids will be able to do. And then we want to do like a lot more education and all of that in there, but
yeah, I think outreach probably.
Yeah. I will be delighted when we have full staff so that I can focus more on a lot of that stuff that I really want to be out there doing. And I think having somebody dedicated to that community outreach will help us as well, so that we can get those things. But it's been on the list and unfortunately hasn't been able to be fruitioned like I wanted to yet.
You're doing a lot. So Sheila, did you?
Actually, there was this, I had the same question, but just to follow up, what about the staff, like the social workers, psychologists in the local school districts, BOCES? I mean, are they participating in a lot of the trainings that you mentioned, like the Safe Talk? So I know Sally Manning is well known.
She is. We're working on getting the avenues right to connect with those folks. Being not in this area, some of that has been like troubleshooting, but I did just get information on what the group of social workers that are in the schools is. So I've asked for an invitation to one of their meetings because they meet regularly. But that it's, again, something that we really want to make sure that we're focusing on. And now that we're starting this year with our specific schedule of the assist and the Safe Talk and all of that, we've got the bandwidth to be able to do that communication now and that training. So we're going to build out the full calendar year so that we can send that out to folks to fit where they need. And if we need to go outbound and do it somewhere, we will do that as well.
That's great. Because I know that, certainly Ithaca City School District, but surrounding districts, there's been a lot of transition, as a result of, COVID, resignations, retirement, and so forth. So I know that, there are a lot of newer, they may be experienced certainly, but a lot of new mental health staff.
Yeah, we definitely want to get in touch with all of them.
Okay, I see Stu.
Yeah, welcome. A lot of good energy I'm hearing and helpful to our community. Members of the board have been having a history of being a supporter, particularly of your organization. Sometimes though, it's been a little trouble with some of the financing. So I don't know if this is a place to ask you or not, but are you fully funded? Do you see your funding stream from the various sources continuing? Sounds like there's a lot of expansion that's on your plate. Can you tell us a little bit about that?
Yeah, we, with all of the expansion that we have opportunities for additional funding, especially with 988, because that is out of a very large pool, federally. Adding, we may be adding chat and text with them, and also being this pilot program for this new service, and adding our counties that we had before will all open up much more. Early alert is a great funding source for us as well. And we're also, a lot of my background is income development. So we are looking at like the donor engagement pieces of everything. And eventually I would like to have somebody that is focused on that within the organization as well. So we're really trying to amp up some of those things as well.
Good to hear.
Yeah.
First of all, I think you guys are doing really amazing work, and I just really appreciate you coming out and sharing all the wonderful things you all are doing. One quick question, just so I can help people anticipate. Do you have numbers on the call answering time of like how long people are?
Like how quickly it's answered.
Yeah.
Yeah, 9 seconds. If they call 988, it's
Yeah.
within 9 seconds. Our line, if they call 1616, it's probably within 2. Our people are picking it up within, they're picking it up before it even finishes ringing once.
Wow.
272.
Yeah. Yeah, the 988 is routed through the National Call Center. They're not based on geolocation, they're based on your area code versus what your footprint is. So they get a recording, and it's got some questions before it's routed to us. So between that and then, so we pick it up on the first or second ring still, but that's about 9 seconds that they've had to wait.
And second is just more of a comment. I'm over at Northeast Pediatrics and working with the Peds World.
We can't hear you.
Oh, apologies. I work over at Northeast Pediatrics in the Peds World and have been doing a lot more meetings with the school. So if you, I'm happy to be of help. I mean, Sally Banning knows more than I do, but let me know if I can be of help.
Oh, that'd be great.
Outreaching to the schools.
Yeah, all the avenues are how I want to break in there. Larry.
Can you talk about your board, who's on it, what skills people have, and what your plans are going forth? Because I know that part of the concern of this board was the size of the board and the range of, people who are on it. So can you talk about who's on your board, the skills, the abilities, that kind of thing?
Sure. So our board president right now is Lynn Gitlow. She's an occupational professor at Ithaca. Our vice chair is Melinda Casalini, who is also an occupational associate professor at Ithaca. Our treasurer is Joshua Knapp, who is a senior teller, soon to be branch manager at Tompkins Financial. Our secretary is John Halchak, who is communication manager for 911. As of board members right now, we confirmed we have Sam Pulliam, who also works at the sheriff's department. And we have Anthony Kondo, who is the head coach of polo at Cornell, who is really, really touched. They do a fundraiser for us every year, and it's been really great. Two of the people who are slated to be voted in at our January meeting are Karina Benitez, who is a psychotherapist, psychologist, one of those. And we also have Kathleen Reddy, who is a past therapist who is on our board right now. Another prospect that we have that will be voting in is Maureen Coates, who works at the behavioral unit at CMC. And then we have a paralegal that the name is escaping me that is on a prospect list that we've got to do interviews for, which is something I don't think was done in the past, is we're really, really vetting these folks of what the expectations are and what we want from them and what they can bring to the table for us, because we don't just want to fill warm bodies into seats. We want to make sure that they're going to be intentional for the organization. So beyond those, we do have 2 openings that we are looking for viable prospects for.
Great, that sounds good. And
Yeah.
Can you talk a little bit about maybe some connections in the community that you're making, like directors and other people that you're meeting and getting to know, and what kind of support you think you would be useful from this board?
Yeah, so I have been doing all of the tabling myself since I joined, which has been really helpful. My favorite part of those is networking with the other people that are set up there. The community that attends is really great, but it's really those other organizations that my focus is, so that I can, make those connections there. Scott McLeod from the Sophie Fund has been incredibly useful for us. We meet regularly about every 2 months and just for updates, and he shared some of those board prospect names with me and like where we can go from here, and like really helping to understand the history of where the organization has been. I have taught several classes at Cornell on suicide prevention, building connections with a lot of professors there and seeing where we can grow from that. CMC, we are back doing the groups in their behavioral unit once a month, that had sunsetted for a little while. And really anywhere that we can get out. I am part of the executive exchange in Tompkins County that has been really useful as well. And we'll be at the meeting on Thursday. I haven't attended one of the meetings with them yet. I attended a retreat that we had a couple months ago, but that has been really helpful too. And I'm also a Rotarian, so I'm building some connections there as well. And once we've got all of our staff built, I'll actually be able to attend and like really do some networking at these things. It's been hit or miss now because I've been filling in on the lines and doing 8 million interviews every week and all of that stuff. But I think the foundation for a lot of those things is built right now. But I am happy any connections or wherever I can talk about what we're doing and, the impact that we're making in the community and learn more about what those needs are with the schools and things like that. That's where I want to live, so that will help to structure where our goals are going to be in our direction.
Great. And just to let people know, I'm one of the people who helps with the annual mental health conference, and Tiffany jumped in, right away and was very helpful in putting the conference together this year. So, I was very happy about that.
Any other questions for Tiffany? Okay, well, thank you so much for coming. It sounds like you're doing amazing work.
Great work.
Yeah, it's been busy.
Sounds it. And the commute on top of that, I'm impressed.
I enjoy the commute. Like getting here is my figure out my day. And on the way home, I call my mom when I leave my parking lot until I get to my door. And that is my mom time and my debrief and like all the things. And I'm like, I'm in my driveway. Okay, bye.
Never
It
waste a minute.
works really well. Yes.
Thank you
yeah.
so much.
Thank you. Mind leaving? Sure. Okay. Thank you guys so much. I really do appreciate it.
Okay, so next up we have a report, the deputy commissioner's report from Harmony.
So thank you, Elise. And Mary had asked that I provide an overview of everything we worked on in 2022, I think, right? And so I thought, okay, so I hope I don't put you all to sleep during this process. And what I did was in your package, you'll see I have 2 reports for you to look at. And for those of you who are virtual, you have received this information in an email that was just sent out to you right before the meeting, so it should be easy to find. So because I don't feel like we can really talk about 2022 without also saying, okay, what are we doing in 2023 to sort of build on that? With the one caveat that 2023 is going to be an interesting year in terms of establishing what our plan will be for the new 3-year 2024, 25, 26. I have not heard any updates on that. I am imagining there's going to be more coming out in March on that. So once I know, I will keep you posted, and we may look at our plan and say, wow, we bit off too much for 2023 when we have to do this other work. So we could just keep that in mind for that 3-year plan coming down the pike. I think Elise, you said, well, we've really kind of already created our 3-year plan because, and you'll see that right from 2022, we have a lot of things that we did a ton of work on, but we didn't quite finalize that work. So we pulled those things over into the 2023 plan. So if you look at the 2022 document, and I try to write these similarly so that you can sort of compare as we go, you'll see the first thing is crisis services was the first goal area we had for 2022. And I apologize for people that are seeing my back of my head. I'll try and look at you periodically as well. Kind of a bad spot that I'm in. But the crisis services goal, you'll also see right there, it says the goal address the growing need for improved crisis services as measured by, and then we had a number of objectives. And then what I have next to that in the next column over is what subcommittee was responsible. If it's all subcommittees, I say that, and then just try and give you a little bit of an update, whether it was achieved, partially achieved, or if we didn't even really get to it. And you will see pretty much everything was achieved or partially achieved. And if we felt like there was more work to be done, that got moved into our 2023 plan. So what I can tell you on this first section for crisis services is that on number 4, implement at least 2 activities designed to improve relationships with policing agencies and mental health recipients. We did do some work on that. We had somebody from the mental health subcommittee, I believe it was, who attended the CIT training for law enforcement officers that was done early on in the year. So there was some participation in trying to NAMI did a presentation for those officers who did a week-long training and got better understanding of mental illness and what mental health crisis can look like. And the whole event ends with a panel of people talking, who have lived experience, talking about what their experiences were like when law enforcement was involved, when they had a mental health crisis, and really created a good understanding for law enforcement officers. Like, this is what it's like if you're hearing voices in your head and you can't really quite control what's happening around you and what that might look like. So and they say in the training, that's the best part of the training because people really get to have these experiences and personal part there. So we did have membership attend part of that training. Anami did a presentation. I did a presentation. We coded some things like that for people as well, law enforcement. And there are going to be continuous trainings going on with that. The next step for the county in that, and that really was spearheaded by the Sheriff's Department, is to have a train the trainer, a CIT train the trainer model. So they've identified a marriage and family therapist that works in the jail, and somebody from the Sheriff's Department who would become the trainers for that. But we're waiting for OMH to set the dates for that train the trainer so that they can continue expanding that model in our county. But this piece about like some work that we could do as a subcommittee, the mental health subcommittee, on improving relations and communicating and understanding what it's like to have mental health problems, and also if you're involved in law enforcement, what that's like and how to improve that. We're going to move into 2023 because that was the one part there that we felt we should do some more work on. So the next thing in the 2022 plan, because you have it now, so you can go back, and I don't want to make this whole entire thing line by line, is under recruitment and retention. That is another one that's a goal that was identified in 2023. We put that as our first workforce recruitment and retention, our first need area for the 2023 plan, because this has just been a huge need. And it really just impacts our work in every other area, because if you don't have staff to do the services, even if those services in theory exist, they don't, right? And we really saw that was an issue, especially in developmental disabilities services. There were like 30 beds that went offline just because they didn't have enough staff for them. So we also had all the subcommittees participated and did a lot of interesting work around solutions that they thought, like, what could we do locally about the issue? Like, we can advocate all day for improved money and so forth. And I think Tom Lippa did a lot as with the substance use subcommittee talked about like, what are the other motivating factors besides money? Like, why aren't people entering our profession? What other things are there that we can look at? But every subcommittee did a lot of brainstorming and created a plan of like ideas that they thought. So the next step we had tried to get to in 2022 and didn't have time for was bringing all of that information. I think it was Larry's idea. Don't create another meeting. Bring that information right to the Community Services Board. Let's take all of that problem solving effort, hear from each subcommittee, and maybe put an integrated plan together. So we pulled that idea over into the 2023 plan as well, because there had been a ton of work. Felt like people did a lot of like, and what was interesting being in all of the 3 meetings from the subcommittees is everybody had different ideas. So it was really nice that we did it separately like that, because each group had like a different perspective of it and brought forward a lot of interesting ideas that I think sharing that information with our community is something we can do at the local level while we continue to advocate for improved rates of reimbursement that result in improved pay for people in the profession, because we know that that's a significant issue. And all of the Office of Mental Health, Substance Use, Developmental Disabilities, there's no state agency that does not recognize the severity of this issue. And we know it's not just in our field, right? It's everybody, but the severity of the issue for us is that these are programs that have been underpaid for so long. The catch up is really tough. And they're doing a lot of really creative things. The Office of People with Developmental Disabilities in particular is doing all this work with BOCES. They're really trying to get in young and promote. Think about a career in this field, right? They're looking at paying for people's education now, but those are like things that we are probably going to see the benefits from in like 5-8 years. So it's like we're in this crunch right now. What do we do in the interim? So this advocacy was not just at our county, right? It's every county across the state said this is a huge issue. And the state did hear that. And the federal government, I think to some extent. But, we've seen inflation too, right? So there's been this erosion of bonuses that people have gotten or improved rates of pay. So what are some other solutions? And I believe we talked last month about the impact of the high cost of housing in our community and how that also impacts this workforce crisis. So that innovation, sharing those innovative ideas is moved over into 2023. And under recruitment and retention, number 3, implementing a data collection system, that's also moved into 2023 and it's developed a little bit more. So if you look at your 2023 workforce recruitment and retention, it's on the first page. You'll see the objectives there. There's solicit staff vacancy information under number 3 under objectives on the first page of 2023. Solicit staff vacancy information from participating provider agencies to better understand local impact. So we're talking to people who come to our subcommittees who are from agencies. Can you share this information with us about your turnover rate, about what kind of vacancies you have? And the second step in there is, can you quantify the loss of services? Because I think to truly advocate for this increased funding and continue that work, I think we still have to be really noisy about it. I think if you can say, we've lost this much service in our community, right? Talking with the Youth Bureau this year, who the County Youth Bureau does a lot of adult services for people with mental health and developmental disabilities. Their staff worked overtime, like just did an incredible amount of work this year, trying to make up for losses in some of these other programs. So you end up like, tiring out the people you have, right? They can't do that for forever. So, okay, so what were those losses? And they try to compensate for them. But if we know more specifically, that will be helpful, I think, for us for continued advocacy. And then if you go back to your 2022 document, and we were on recruitment and retention and turn over to number 4, we're clearly going to continue advocacy. And then number 5 was an idea that had come out of the substance use subcommittee, which was an idea of like, can we work maybe with hospitals or other healthcare providers and trying to like a recruitment strategy where we really advertise our community, broadly speaking, like come here because we're amazing. You're going to love Ithaca. You're going to love the Finger Lakes region and partner with other agencies. That never really got a lift off. We never really did a lot of work on that area, but it was something like, especially when you're looking at very specific, hard to fill positions in agencies. Is there a way we could do more? So that might come up in that whole list of brainstorming ideas and a collection there, but we didn't move that into 2023. It may come in elsewhere, but I did want to just point out that one just we talked about it a little bit, but we never did much else with it. So under developmental disabilities, student transition services, this one is continued in the new plan under the category of crossover systems. Or cross systems, I'm sorry, not crossover, cross systems. And Elise, I think you can speak to this because the developmental disability subcommittee was doing a lot of work on this right before you left.
So I'm sorry, which one?
It's on the supporting post-secondary transition.
Oh, okay.
I just threw that at you. I'm sorry.
Yeah, no, that's okay. So I think the status of that with the DD subcommittee is that we have not had representation from the school district or from the the Ithaca City School District, or in all of my years of being connected with the subcommittee, I don't recall ever having representation from Newfield or Dryden or Trumansburg, but in terms of the school districts, but the Ithaca City School District doesn't have representation, which they always did in the form of Sheila, but Sheila retired. And we have not been able to get Jen Gondak to start attending meetings, who is Sheila's predecessor. And then Barbara Logan retired from the BOCES, and she had been connected to the subcommittee for off and on for years. And since she left, there's no one from the BOCES attending meetings. And it was always a really important connection, especially with the BOCES, because most students that are categorized as having developmental disabilities, a lot of them attend the Smith School. So it's unfortunate that we don't have that connection anymore. So it's been hard to get work done around transition because we're talking to ourselves and the agencies sit in a circle and can tell each other all the great things they have to offer transition age youth, but the schools aren't there.
Yeah.
So.
And just an update to that, the two people that chair that subcommittee, James and Jeff, they will be doing outreach with BOCES and try to the CSE chairs meet regionally monthly. And the hope is, and we're actually going to meet tomorrow. So hopefully James and Jeff will have an update on this. But I think the plan is for them to actually attend that meeting and then, try to get more information from the actual districts. What's working, what's not working, and what do we need to do going forward. So that's hopeful.
Sometimes you got to go to them, right? And they're doing a great job as the
They are
chairs of that subcommittee, and they just have such incredible enthusiasm. So I'm sure if there's a way, there's a will, there's a way, they will get it done. So the point being that it's a struggle right now to really get all the people in the right room. And we're going to continue that in 2023 because it's vital for youth to really transition and get their appropriate services set up well in advance, because if they don't, it is very hard to get those services later on. There's like this one window of opportunity for young people that we really want to make sure continues to be a focus of efforts. And I had missed the last meeting, Sheila, so I couldn't remember which. Sorry about that, Elise.
That's okay. And for future reference, December was my last DD subject.
So
now I'm totally out of the loop.
I missed the last one, so I was like, I know something was on this topic. So that's a great plan. So then the next area that we had on here is prevention services. And that was really from the substance use subcommittee, focusing on prevention services. That was identified, because of the legalization of marijuana, issues around vaping and all the different products that are available to use, like and also legalization of gambling, online gambling in New York State. So there was a lot that happened around that issue, and to just make sure our prevention providers were really in the right position to meet that sort of need. So we had them come and attend a number of meetings and learn more about the services they're providing. And the clinic too, we've been working a lot recently on how do we improve referrals, right? Maybe if a youth gets the Teen Intervene program, which is a very nice evidence-based short intervention for youth who are sort of dabbling with substances. If a youth needs more support than that, they can be referred for an evaluation if they may need treatment. And sometimes they meet youth that really could also benefit from more of our mental health services. And since we're also in schools, how do we improve that relationship? Like, how can we help support kids maybe getting Teen Intervene? How can they send children our direction if that, or young people, teens, middle school teenagers, if that's the right direction for them in those services. So continuing to work on improving just access to services that are there, but maybe in our own little tunnels. So that did not move over because we did a lot of work on that this year. And then there were, work on the substance use disorder residential treatment services, and also the category heroin, opioid programs and services. So the substance use subcommittee did work in that area as well. Alcohol and Drug Council should be having their open access detox program in Lansing. It should be opening sometime soon in the new year. I know at the last minute, they had no delays in getting any of the materials, which was sort of a miracle. And then the last minute, they had a delay in a crucial thing. I don't know. I don't really understand it. A mechanical thing that they needed. And there was a delay in receiving that. So, but they should be on course. Cuba Addiction and Recovery Services has been working on their 25-bed women's inpatient long-term program for forever, I think. And there were some delays they had with construction that sort of derailed for this year, but they're hoping to move forward. And that worked for the building portion of that next year. And identifying strategies that have been shown to be effective in reducing opioid addiction and deaths. A lot of work in that regard in terms of the legislature established an opioid task force that's looking at the settlement dollars, and it's been the membership has been identified by the legislature, and then myself, Frank, and Brenda from Public Health, and the intern Zoe Lincoln that's been working with us meet with that task force to provide them any kinds of information that they may request as they make their decision making. So I'm sure that will be an area where we'll see some growth in our community. And then we're also working on our project, the resources of the public health department now, and really looking at fatalities, the opioid crisis that we've experienced from both a public health and a mental health co-occurring disorder perspective. So looking at ways to really improve community knowledge, creating better transparency of what we know about the issues in our own community, and figuring out how to do that, which is complicated to know what you share and how you share it and all that sort of thing. But so there's been a lot of work on that with the public health fellow and figuring out how to maybe post some of that information and what other strategies we could use. So other mental health services we had in here was really focused on children's services. And you'd mentioned Sally, is well known by most of the children's people. Sally, the SPOA coordinator, came and spoke to the mental health subcommittee on this. And we did a number of the activities about better understanding where the gaps in services. We received a system of care grant through the Office of Mental Health this year, and did sort of like that sequential intercept map, which is finding gaps in our legal system and trying to prevent people from getting in the legal system when their primary need is really mental health or substance use or developmental disability services. So this was a planning process through the Office of Mental Health to identify any gaps in our children's services and creating an action plan of how we want to address that. So that work is done. And the good news is OMH was a little bit slow getting the money out to us. And then our contracting process we discovered was there's an inverse relationship. The smaller the contract, the harder the work to get it implemented, right? So it took us some time to get everybody in place for this grant of $25,000. So apparently that was a problem across the state because OMH extended it for another year for us to use the dollars. We have identified some grants that we're hoping to pursue that could really create some more intensive in-home community services. So we're working on that with the grant writer so we can meet, that's a significant gap services for us. So that work's going to continue through the Collaborative Solutions Network, which is our system of care for children. The one area that we did shift over under this goal for next year was adverse childhood experiences, creating greater awareness in our community around that. We just didn't have time to get to it. So we did move that over into our plan for next year. So, well, our next year, 2023, which is now. So that's kind of a summary, a lot of work, I think, really that happened in 2022, and really anything that we felt really needed to be pushed over into the next year we've done. So you'll see the 2023 one. I won't go into all of the details with that one because we have done that already for this year, but you have it kind of there in writing of what are the particular objectives, what's the time frame, and what's the subcommittee that's working on that. And people have already started working on, before the new year started, working on some of these, like housing rights to the substance use subcommittee has been working on housing, had somebody from Oasis come and talk about housing from the state Oasis perspective. And then this month we having someone come, we just were talking about this.
Right. From what's the
from-
organization?
I wrote, I think, a cheat for my to remember. Did you say what it was? I couldn't hear you.
Downstairs, we talked about.
We just talked about it, like, oh, come on, Cran, who did we? Yeah, from
Second
Wind Cottages.
Yeah.
Thank you. That's who's going to be speaking this week at our subcommittee. Between the three of us, one of us will remember who it is. But there's been a series in some of the subcommittees really focusing a lot on getting better understanding of housing services across the mental hygiene system. And then just broadly, what are the needs in the community? I think that was one of the things Larry really wanted to know more about. I feel like the subcommittees right now are collecting a lot of information, each one of them about their own area of specialization. So we'll be in good shape to put all that information together and then have that, shared with the board down the road.
I think we're following a good process, written word, and then getting the folks to come in to talk about it, get it involved in the committees and moving forward from there. A lot of it's on the speaker's side. This is what they're doing on their own. We're encouraging them, supporting or making, comments about how that is working, but certainly more services seem to be coming to our area based on, thinking it out and putting it as our goals, and some of it's actually happening.
Yeah, it's nice when you see that, when you write it all down and then you start to see there is progress. Sometimes it feels like these issues are so large, you don't see the progress, but when you write it all down and you start checking over time, you do see you're moving in the right way. It's just, we all, like Tiffany was saying, you want to see it faster. Larry, did you have a question?
Well, I didn't have a question. I had a comment, which I made at the mental health subcommittee. Whenever Harmony does this presentation about all the work we're doing, she leaves out that really it's her leadership and the support from Karen that makes it really possible for the subcommittees to do this work. I mean, I think in the role of planning, she's really been the resource that has helped us to do some of this work.
Well, thank you, Larry. It's fun to do it. It's fun to do it and see people, learn and plan and have an opportunity to do it.
And I really love the way you format this. This is very helpful. And it's easy to follow, to digest. So I really do like this format.
I've said that to you before too. It's good.
Great. Any other questions or comments for Harmony?
Okay, well, thanks. I have plans, hopefully, to invite some folks that are attached to the objectives in the 2023 plan to come present here throughout the year. I would like to have the new chair, the incoming chair of the Workforce Development Board, whose name I don't know, come here to talk about the workforce crisis. There was a report that came out from the Rockefeller Institute on behalf of the New York State Association of Training and Employment Professionals. They do it every year. I think it came out this week, and it showed not only do we have a huge gap in the number of people available in the direct support workforce, it's the fastest growing segment of the workforce in New York State. So the gap's going to keep getting bigger and bigger. And I think we need to get the workforce development system involved. So hopefully they'll come here and talk to us or engage us in a conversation about it. We tried to do that in the DD subcommittee, but the person who came was the outgoing chair, and she seemed to not be super involved at that point. So, and then the other thing is I'm hoping we can get the opioid task force folks to come and present to us again at some point this year on their progress. So I did speak with one of them the other day, and they have some good ideas. I think people have different ideas about how the money should be spent. So it'll be interesting to see what they land on. Yeah. Great. Thanks. Yeah.
I'd like to be able to go into executive session.
Did we have one on the agenda?
No. Do we have a? Quote?
Because
Mary left.
Oh, okay. Never mind.
Oh, sorry.
it wasn't planned. It
Oh.
just had to do with
Somebody-
reapplication for someone, but then we lost our quorum when Mary had to leave. So
Okay. Yeah. So
sorry for the confusion.
So for those of you online, and the only reason I bring this up is because I've just been through this with another advisory board that I was on and picking apart the parts of open meetings law that apply to these types of boards. So being able to participate remotely is a great option for some folks sometimes, but it is limiting now that we are required to be back in person. You can't count in quorum if you're online. So if people can make an effort to be here in person, there are a few exemptions to the open meetings law. One is having a disability that makes it more easier for you to participate from home. Another would be caregiving, childcare responsibilities, I think was on the list as an exception. I'll have to double check that one. But there are actually in the regulations very few exceptions to the requirement to be present. So if people are able to be present, that would be great so that we can conduct business. Larry, did you have your hand up?
Well, I don't want to whine about this too much, but I really feel like this is another example of how governments pretend that they don't know how to use technology to facilitate the participation of people so like we were fine when it was, a public health emergency, but somehow we have suddenly decided, no, we really all have to get together, which limits the ability of it's like people who still don't know the importance of accessibility and the importance of adaptive equipment. It's like we keep making progress and then stepping back. I mean, I'm able to come over to the building, but what if what if somebody was homebound and wanted to participate as a member of it would be a reason to include them in the quorum, but we immediately stopped using all these things that we discovered.
Right.
Yeah. Yeah, I agree. It's interesting. I mean, it was a bit of a surprise to swing back that far, but that's where we are. So Jessica, did you have a question?
Two parts. One, could we find the language around the exceptions and send that out?
I have it. I have a PowerPoint that contains all of the it's like subpart 2, Article 52 or something like that of open meetings law. And I couldn't find it earlier, but I'll find it and I'll send it.
For folks who do qualify under the exceptions, is there a way to get that approved so then they could participate online and count towards quorum?
I don't think so. And I think that's
So it-
Larry's point, you know, it's like, okay,
Exception, but not.
it's right. So it's an exception, but you still don't count. So the reason why for the exception is because we, in this county, we broadcast and make all of these meetings open and available to people online. But some meetings don't. So then the requirement was if you have a single person that has to be online, you must make that online space. So it's more tricky for meetings that don't typically broadcast. It's harder because then it's like if you've got one person that can't be there and wants to be online, then the whole thing has to be broadcast and somehow made public, and it's a little bit more complicated. I think for me, the bigger issue is that if you had, so I do believe that unless there's, you know, some extenuating circumstances, people should try to be present at meetings, but there are extenuating circumstances. And my biggest concern, as Larry said, is for people with disabilities, because if their vote is taken away because they can't be present. So we can pick that apart. I mean, I think it sounds to me like school boards have like taken those regs and made their own interpretation of them, because I think it's the same rules that govern school boards and they've done something different. So,
Right, I was gonna say school board in Ithaca, you can be on Zoom and your vote counts.
yeah. And that's the rule that I've read definitely says that unless there's a different rule for school boards, but yeah, so I'll find that. I didn't put it together. I borrowed it from something called the Most Integrated Settings Council that the state of New York has. So yeah, we'll figure it out.
I find our inability to deal with the technology we have is really, really stunning. And also I think is based on a lack of wanting to include as many people as.
Yeah. Yeah, it's difficult. It's difficult because obviously we had enough people participating that we could have gone into an executive session tonight. So we can't. But yeah, we'll work on it. We'll see what we can do, but that's the way it is for now. All right, anything else?
And that's dictated by state law, right?
Mhm.
So it seems like with legislative session coming up, maybe that's something that could be worked on.
Yeah, yeah.
Although I'm sure there's other things that'll more attention grabbing that.
Well, you know, Kim Hill,
Governor.
who's in the new governor's office on disability, that might be something that Kim Hill, who's the chief officer on disability for the state of New York, might be willing to take up, because she's focused on those really broader, big picture disability issues in the state.
Yeah. That would be good.
Yeah.
Mhm.
Okay, anything else? All right, motion to adjourn,
So move.
second? Second. Okay, I don't think we need to vote to adjourn. We're adjourned.
Thanks for doing it.
If anyone this,
For 1 year.
and
Yeah.
yeah.
They're gonna change those rules. Other rules.
Good evening, everyone.